need to take a break or walk away, grab something to eat, whatever, please feel free to do so. Don't hold it and hurt yourself or not go get something to drink when you need it. Pass out because there's no way of us helping you out. Okay, so let's jump into what whole health coaching is. So after everything that you just heard Charlie talk about for like the longest time, what do you think? I just wanted to see him spit out his drink. What do you think whole health coaching is? In your own words, just throw it out there. What is it to you?
I
Okay.
think it's individualizing care from a different, like all different aspects from health, wellness, mental health, financial, community, family, spiritual, and individualizing the care to that one person's specific needs.
Okay, so individualizing care across the board, it sounds like, right?
Correct.
Oh, I was gonna say, I think it's like when you're working with somebody and you look at all the different aspects and like focusing on each of them with that individual person to like improve their overall whole health, if that makes sense.
Does absolutely. So improvement overall and kind of letting them take the lead. I heard that.
Yeah, I
Marco?
was kind of thinking just allowing the individual to be in the driver's seat of things and really seeing what their whole health looks like and what they want it to look like and helping support in that way.
Yeah, in the driver's seat. I mean, that's truly the key. They're the ones kind of telling you what they need, right? Versus me saying, you need to take your pills, right? How effective is that? Armando, I think I saw you unmute as well earlier.
I mean, it was pretty much the same. But going off the, putting them in the driving seat is essentially just being that guidance there. But just kind of being the barriers on each side. So not telling them what to do, but kind of giving them that guidance, the GPS essentially to the end goal.
I like it, GPS. So that's actually along the lines of what I usually say too. It's kind of like you're holding the map and basically kind of helping to guide them down the path, but they're telling you where they want to end up, right? They're telling you, I want to make a pit stop here, here, and here, and I want to ultimately get here. Can you help me get there? And we're just kind of right there beside them, talking through it, right? So that's perfect. GPS, I like it. So if you wanted to get a kind of just a general good definition, here it is for you. Assisting clients to realize their own health goals based on their lives' mission, aspiration, and purpose. We call this their map, their mission, aspiration, and purpose. So if you hear us refer to their map, that's what we're talking about, okay? So here's some thoughts of coaches in the past. Who wants to read this one for me? I can't ask Charlie. I can't ask Todd because they can't read, but maybe one of you guys.
I'll read it.
Okay.
Thoughts on coaching. Because healing is a process, the metamorphosis of the role of doctor to healer is the change from doer to helper, from expert problem solver and fixer to servant and companion, and accompanier on the healing journey.
Exactly right. Thank you. So you're not fixing things, right? From what that says, you're not there to be the ultimate problem solver. You don't have to know everything to be a coach. What we're there to do is help guide down that journey, down that path, and help them to truly decide what it is that they want out of their health and wellness. I mean, that's the scope of it right there. So Harvard Publishing had this little quote from Dr. Peter Grinspoon. I think I just like to say his name, Grinspoon. Seems like a cool last name. So he said, unlike health fads that come and go, health coaching has strong evidence behind it, backing its effectiveness for improving health and well being. Becoming a health coach has been deeply rewarding to me because it is rare in life that you get to promote happiness, build resiliency, save people money, and help people live longer and more fulfilling lives at the same time. Ultimately, meaning his experience as a coach has broadened his scope of knowledge as far as it comes to helping people out, helping them to achieve the goals that they want to achieve. So, when you dive into this health and wellness coaching journey, think about it as you kind of build your skill set on what really drives you. What is it that gets you up in the morning and helps you to help lead other people down that path, right? Because that's what's gonna kind of help push you throughout this journey. So there's two distinguishing features when it comes to coaching. One, the belief behind integrative health coaching is that behavior changes of the person you're coaching are sustainable when linked to the person's value and sense of purpose. So hearing that, what does that mean?
I know, Haley. I know.
It's essentially, I would say, there's a word for it, but I can't think of the word. But essentially, it's saying it there, like their personal values and sense of purpose. So they're gonna do things that they value. Like people don't do things that they don't see any value in, that they see themselves in there. So when you can include values and you can include things that they like to do or things that they find interesting, you're gonna have behavioral changes because it's something they like to do. But so you're not gonna get the opposite. You're gonna get the opposite if you're not interested in something, and that's why people always struggle to like learn things or do things because it's not something they want to do, or they find no value in it. So you gotta have to show that value or that sense of purpose
Yeah.
for that.
Yeah. So we can easily use your career as an example, right? So you train and coach people, right? In the
Yes.
physical sense.
Mhm.
All right. So if somebody comes in there and they want to be trained and they're like, I'm going to drop 100 pounds, do they usually follow through? Do they show up the next day if you just have that conversation, nothing else around that? Just I'm here to lose weight. Are they going to keep showing up and lose all that weight, you think?
No, you have to dig. I'm skipping ahead, but you have to dig in deep and find the reason, um, the emotional reason for it. Usually, there is something that is causing that change, or the reason that they want that change. It can be anything that, from embarrassment, of a life event, someone called them fat, or whatever the case may be, and it's finding that emotional character, that emotional um there's a word for it again and I keep losing my mind but pretty much you want to find that cause, and it's usually emotional, or it's an event that's happened. So, and that's what's going to cause change. Without that, you're never going to have that change.
100%. And I think Todd wants to build on that. It looked like he was about to jump in. Go for it. I know you're killing it.
I'm not the sharpest pencil in the cup or anything like that. So I like to break things down as simple as I can to help them make sense in my own mind. And as much as this pains me to say this, because I used to be a drill sergeant, people do not do things because they're told to do them. They do things because they want to. And there's got to be a why behind that want to. And simply spoken, what a coach does is help them find their why.
And Todd, I'm going to add on to yours just from like a personal note. I recently had a conversation about like a behavior, and the person said, I'm going to do what I want to do when I want to do it and how I want to do it. So, it just kind of leads into this where if they don't want to do something, or if they don't realize something might be an issue, no matter if you see it or not, they're not going to do it just because you want them to do it. They need to be motivated into making that change.
Every one of us in this room can spend 10 minutes with somebody, and I bet have a plan and be able to tell that person exactly what they got to do, and their life will be rainbows and unicorns.
Yes.
But none of that matters because it's got to be linked to the want and the why.
Todd, remind me to get with you after class and tell me how to make my life rainbows and unicorns, please.
I could tell you, but you wouldn't listen.
That's right. I wouldn't. You're right. Todd's exactly right, and you're all exactly right. You have to connect it to the why. Now, if I were to come into a gym and say, I need to lose 100 pounds, but I have a wedding that a close family friend is getting married, right? And I want to be there for them. I want to look great. I want to feel great. I want to be my best at this time. That gives me something to work with, right? That gives me a little bit of a target date and a target thing, but it's still not deep enough. Why do I want to feel good enough? Why do I want to look different? We got to keep digging into that why. And then when it comes down to it, and I say, listen, one day I'd like to get married. I'd like to be healthy enough to have a day like that myself. That's when we get to that why, right? We start building off of what really drives somebody to achieve a goal. And that's ultimately what coaching is. Oh, I got dogs going crazy behind me. Sorry. Oh, somebody got a bone and they're not sharing. All right. Let's see. So there's a video here, and I'm going to hit play and hopefully it'll work.
I chose truck driving as a living. Being in the truck, you got a lot of freedom. You're out there, you're your own man, you know, and there's nobody standing over top of you telling you exactly what you got to do.
But when Hugh Williams' blood sugar spiked, he failed his work physical.
I think it was kind of a shock to him when they told him that he couldn't work.
Been driving a truck for 39 years, I don't know what else I would do. That's the lowest point of my life, I guess.
The drug abuse just got worse, you know. It was like a downward spiral. The more I missed out on life, the worse I felt about myself.
Michael Perry found himself out on the streets, homeless and jobless, all due to his addiction.
I was at that point of hopelessness. Do you really want to die? I'm like, no, I don't. But I don't know how to help myself. And I want to help myself.
By the time these veterans turned to the Fayetteville VA Medical Center, they had both hit bottom. Expecting business as usual, they were intrigued when asked to participate in a new type of patient-driven care called integrative health coaching.
Integrative health coaching model is about treating the whole person, mind, body, soul, and spirit.
It's not, I'm going to the doctor and the doctor's going to take my blood pressure medicine and he's going to tell me I need to lower my salt. It is engaging the patient in their own health care.
I've got to get my A1C down so I can go back to work.
Nurse practitioner Janice Rogers recognized that for Hugh, traditional doctor's visits were not getting the job done.
So you were feeling okay,
Yeah.
and you had kind of gotten away from testing your blood sugars. What other barriers had you been running into?
Sometimes I wouldn't take my pills. I mean, not every day, you know.
Integrative health coaching offered Jan an innovative and dynamic way to empower Hugh, putting him in the driver's seat when it came to his own health care decisions.
Did anything kind of jump out at you?
Yeah, about everything. I
Okay.
hadn't done anything right. It was a one-on-one, and we met every week for an hour.
What steps would you like to take to reach this goal?
Well, we get the exercise bike. I'll start riding it and lifting that 20-pound weight. She didn't tell me what to do. She asked me, what did I think I could do?
Just looking at the wheel, you being in the center of it, how all these areas of your life actually really impact your health, and you being not even being mindful of it.
The components of proactive health and well-being, commonly called the wheel, is divided into segments, each representing a portion of a person's life. The personal health inventory is built around the components of the wheel and allows the patient to get an accurate idea of where they currently are and then look at where they want to be in their lives.
So it looks like you focused on the area of surroundings here. Okay.
Yeah.
It is important to ask what's important to the veteran because it allows them to gauge their motivation and also prioritize which goals they are looking to work on first.
If I don't tell you what's wrong with me, you can't help me.
So the next area on our wheel of health has to do with food and drink. You rated yourself as a 5, and you put down, I just don't eat right.
That's right.
Okay? But you really want to move yourself up to a 10.
Yes. When you're filling this thing out, if you're telling a lie about it, how you really feel that you're doing, you're not helping yourself, because this is all about you.
If you can sum up for me, what really matters to Mr. Perry in his life?
Focusing on my recovery from addiction.
Once the inventory is completed, coaches work closely with patients to analyze their answers and help the patient formulate a customized healthcare plan with both short and long-term goals.
Doing that inventory, it kind of gave me a perspective of where I wanted to go. You know, I knew that I wanted to regain my relationship with God. I knew that.
And he felt like that's what kept him connected to his community, his family, and who he was coming up.
Without this crucial support, Michael had been unable to stick with any treatment program. This new holistic approach uncovered a need that traditional medicine would never have found. Reconnecting to his spirituality gave Michael the ability to set ambitious goals and stick with them.
We worked on being Michael Perry, the business owner. You know, Michael Perry, the daddy. You know, the uncle. You know, and the son. We worked on that.
Hugh found his motivation somewhere else.
Miss Rogers asked me what was important to me. And I told her that working was the most important thing in my life.
He likes to be able to provide for his family, and that was a big motivator for him. He wanted to go back out on the road. So his health became personal.
As Hugh developed a new healthcare plan that revolved around diet and exercise, Jan was there to help.
We sent him to the dietary class.
We're going to look at the nutrition label. I have the Cheerios here.
I used to never look at a label. And now the first thing I do when I pick up a can of something, I turn it over and look at the label, look at the sodium intake and the sugar. When I lost all that weight and everything, I really felt better. I mean, I was beginning to feel like I was a young man again,
He's back driving his truck. I don't know who was more excited, me or Mr. Williams. I expected some change, but I did not expect this huge change.
His sessions with Ms. Rogers has helped me to exercise and weight, eating right, and I've lost weight too by doing it.
If the VA centers are not using this coaching, they should be, because it really helps. It gives you confidence in yourself and everything else.
And, empowered by that confidence, Michael is no longer homeless and has been free of drugs and alcohol for over 9 months.
It's a miracle to watch someone transition from who they were before and who they are now. His business is up and operational.
Every time I see Marcia, I thank her. That's all I want was my life back. I did the work to get it, but she pointed me in the right direction. Yeah.
All right. So that's just a video, obviously, that the VA uses. But it brings to light this second distinguishing feature, right? We talked about the why, but the patients bring to the coach the information, recommendations for treatment from the providers, right? And then they get to talk to you about how are they going to integrate that into their life. So you saw that with the truck driver. Tell me a little bit about what you might have taken away from that video when thinking about this second piece of what a coach is.
Well, it's like with the addict, right? It's not just like, well, how are you going to fix your life? Well, I'm gonna stop doing drugs. Well, you have to work on the other aspects of it, you know, who he is as a father and a son and an uncle and the spiritual side of stuff to get him off the drugs. So he has to work on that in order to get off the drugs.
Yeah, 100%, right? So a doctor will look at you and say, okay, yeah, we just got to get you off the drugs.
You stop smoking crack.
That's right. Quit the crack. Then what? So you're exactly right. They are able to then work with somebody like a coach that can help them down that path, help them even know where to start, right? Help them to discover what their map is, their mission, aspiration, purpose. Well, don't play again. All right, there we go. So here's the roles pretty much laid out for you. What we're not going to do is be content experts, right? We are not going to know everything about everything. We do not have to have an MD to be a coach. We do not have to be a therapist to be a coach. Actually, you're usually a better coach when you're not those things because you don't slip into that role, right? A coach is also not here to diagnose or prescribe things. So even though you may know that, oh my gosh, they got some red flags for diabetes. I like to say it that way because that's how the little old man from the show, what's that show called? Where he was he was with the sheriff. Charlie, don't give me that look because I'll start going down Michael Jordan, Michael Jackson there. I don't know. I can't remember the show now. But anyway, he always said diabetes. I have to pull them up for you so you know I'm not crazy. Anyway, so we're not there to point that out and say, oh my gosh, you have diabetes and you're going to need to stop eating all those sweets. That's not for us to say. We should notice the red flags. We should maybe ask them some open-ended questions that helps them to lead to, something's not right. I don't feel good. Maybe I should get some testing done. But we'll figure all that out down the road. As a coach, you should know what those little pieces are, but you're not there to diagnose, okay? So what we're going to do is we're going to have a working knowledge of evidence-based health information and recommendations. We should know these things. And I will say on the health and wellness coaching exam that the board puts together, they go by the CDC guidelines. So if you want to go ahead and jumpstart your studying, if you're planning to take that exam, CDC guidelines are where you want to get your biometric information. Even though it may be a little different than some of the other things that are out there, that's what they go by. You want to understand the basic health recommendations, what it is for health promotion, what it means to prevent diseases. What does that look like? You need to know that general information. Doesn't mean we're going to offer all that information just flat out, but we'll teach you how to use those different tidbits of information that you do have. You also, and we'll get into this later too, this is just to kind of give you an idea of a health coach. You also need to know how to refer them to somebody if they do need more help than what you can give them as a coach. So let's say, for instance, mental health. If they have certain things that are red flags and you know as a coach that's out of your scope, what do we do next? We need to have those kind of ideas ready to roll if it's ever needed. Okay? So that's what a coach is and is not. We're there to support. We are not there to diagnose. We are there to guide. We are not there to tell them what they need to do, right? So here are some accreditations that are out there. Right now, in this course, we are approved by the National Board of Health and Wellness Coaching. So that's that first one there. And we'll kind of send you to their webpage at different times throughout the course. We'll tell you to look different things up and get familiar with their website because they have a lot of good information to help you prepare for that exam if you plan to take it. It also just helps you as a coach to understand a lot of the basics. We are also backed by the Holistic Nursing credentialing. That just means if you are a nurse or plan to be a nurse, you can utilize this course as well to help you gain the information needed to take that. There's another accrediting body. It's called the International Coaching Federation. You are welcome to explore it. We will kind of dive deeper towards the end of the course just to give you more insight into what that is. But to what we teach, we stick more with the National Board of Health and Wellness Coaching, and we kind of consider that more of the kind of gold standard of coaching. ICF is going to be more so, well, it sticks with the motivational interviewing at its core. It's not a whole lot of difference between that part. There's just little minor details that are different. but we'll dive into that another time. Okay, so if you were to go and look at the National Board's website, you'll see their commitment. We've circled it down there for you. Basically, they commit to deepening the learning across the organization and supporting continued development in the communities. They are there to support you in any way they can. They've got a lot of information out there where you can get more information, where you can dig deeper into studies, all that good stuff. So again, just be familiar with that website because it's going to help you in the long run. But with us being accredited through them, we are committed to that as well. So Charlie talked a lot about how we helped with, when we were at the VA, creating those self-sustaining plans out in the community, right? We teach people to go and teach Tai Chi or do Tai Chi classes in the community. We do that with yoga, that kind of stuff. Well, same thing with coaching. The board is telling us basically they want to keep putting more and more coaches out there to help the communities. And that's what really drives Charlie and I when it comes to this. It's basically keeping people out of that hospital, kind of like you said earlier. So these are the characteristics, it's a big word, of a health coach. You're going to see this a lot. We're going to have this in a lot of our different slides. But at the end of the day, these are the things you want to stick close to as you become a coach, right? So your qualities of a coach are being respectful, present, mindful. You have a guiding style when it comes to coaching. You can articulate, which I struggle with apparently to this day. You're succinct, curious, empathetic, a partner, open, and it can go on and on and on. So in your mind, if you were looking at qualities of a coach and you were being coached, what are some qualities you would look for? What's going to make you comfortable? Absolutely nothing's going to make you comfortable.
I would say respectful. I mean, I would say all of them, but
yeah.
Big one for me is respectful, being present, because I know a lot of coaches, they're just there, but you can tell they're not really like listening.
Yeah.
But I've had that experience with a lot of coaches when I was a manager, and being empathetic as well, because you hear so many stories so many times, you become very desensitized to some of the stories, and then you become less empathetic about it. So kind of putting yourself in their shoes and being empathetic of what they're going through and understanding what's going on and being that guidance is a big thing, which is the guiding style as well. So, but I mean, I would say all of them, obviously.
Yeah. Yeah, absolutely. They all kind of embody that coach that you'd be looking for sure. Respect, absolutely. Open-minded and really listening to you. It's 100%, right? You can tell when somebody's not listening to you. If I'm doing a virtual coaching session and I'm talking to you right now, but I'm doing this and I'm like, yeah. You're like, why am I wasting my time talking to this person, right? Like they're looking off somewhere else. They're not even paying attention and they have no idea what's going on. It's very easy to do that in person or virtually and make somebody feel a certain kind of way, even if you don't mean to. Snezna, what you got?
Oh, wow. Yeah, I think we've all had plenty of those meetings where you're sitting, to your point, with somebody and they're all over the place or they're in their phone and I just want to take the phone and do some awful stuff with it. But I agree with this whole entire list, but also what I think is important as far as, for me is being non-judgmental, because sometimes it's really difficult to open up to somebody because there is this fear of, oh, are they going to look at me differently, or are they going to judge me, or how can you help me if you're already judging me? So I think that's a really important one. And also having a sense of humor as well. I think that goes a long way just to kind of make a person feel a little bit at ease and relate to them in a little bit different way.
I agree with that. Absolutely. So two sides to that, right? Humor is a fantastic thing a lot of times, and it can make situations more comfortable. It can put somebody more at ease, especially if they know you're not expecting some kind of perfection when it comes to these sessions of coaching. But on the other hand, on the flip side, there can always be too much of something, right? So if there's somebody where you can tell their personality is not so joking, not so humorous, they're really there for business, we got to pay attention to that too, right? And it's almost like mirroring
your
a person.
audience.
Yep, know your audience, mirror their energy, right? So if they're coming to you in a very serious way, it's okay to lighten the mood a little bit, but don't do the whole time and make them honestly uncomfortable by you trying to lighten their mood, right? That's not our responsibility to lighten their mood. So there's an equal balance to just about everything. But to your point, you speak to your audience. You kind of take into consideration all the different dynamics. Okay. So now we're going to look at that second column. It is coaching skills. So these are the skills that you're going to learn a lot about in this course. So asking open-ended questions, allowing self-discovery, meeting the client where they are. Holy poopsicles right there. Meeting them where they are. That is the bread and butter to coaching. We are not telling them where they need to go. We're not telling them where they need to start. They're telling us, and we are just meeting them there, right? Active listening, developing and revisiting visions. We'll talk about more of that. Using tactful skills to interrupt and redirect. Oh my goodness, this is one of the most uncomfortable things for a lot of people. If I were to tell you about a lot of my clients when I was at the VA, well, they were patients. I didn't really call them clients, called them patients, but a lot of them just needed somebody to talk to. Sometimes they were just lonely and they needed to talk. But I had a very limited amount of time of how much time I could sit and talk to them because I had a full day of patients. So when is it appropriate to interrupt and redirect? But how do I do it in a respectful way as well? So we'll talk more about that in the coaching course. And then reflections, we'll talk about those a lot, but it's basically taking their words and reflecting it back to them. People can say some pretty amazing things and not even realize it or not even truly understand what they just said until somebody reflects it back to them. And then they're like, holy moly, that's big. And those are my words. So we'll talk about the power of that. What are you laughing at over there, Killa?
No, I was going to say, or they'll tell you, I didn't say that.
Or they'll say that, but if you're reflecting right after them, there's really no way for them to deny it. But yes.
No, that is one of the powers of the reflection, though, because I have verbatim reflected back to somebody. That's not what I said. I go, well, then what did you say? You got that. It allows for clarification.
Mm-hmm.
And that's one of what makes it very useful.
Yeah, it absolutely allows for that clarification. It helps you to understand what it really is that they're trying to tell you. And then there's coaching strategies. Again, we'll talk more about this. This is just to introduce you to it, but you're going to help facilitate vision. What do they visualize as being the end result or where they're wanting to go with things? Explore their values. What is it that they value that you can connect to this and create maybe an approach where they're continuously motivated by those values, right? Establishing an area of focus. I may tell you I want to lose 100 pounds, but that's not something I just go and do. There's going to be little small steps that get me there, little behavioral changes that are going to add up to that in the end. Facilitating a long-term behavioral goal, guiding clients towards the action steps and leading them to that long-term sustainment and behavioral goals. Utilizing the technique of SMART. You guys ever heard of a SMART goal and how to break that down? Todd hasn't. We're going to educate him a little later, but those come in very important.
Sorry, I saw it like early on when we were looking at it. I was like, I don't want to get ahead of things, but I just had like 18,000 flashbacks to social work classes with SMART goals, and it was like ingrained in us. And then I was like, oh my gosh, did I forget what SMART goals stands for? So I was over here like, pay attention, trying to like run through it. Anyways, continue. I just Yes.
You're good. And even if you forgot it, we're going to go into it pretty deeply in some of the courses ahead of us. So not to worry, we'll give you a good review of them.
Don't tell any of my former professors that I briefly forgot it. They would be devastated.
Devastated. No, you're good. We'll get you reminded and then just pretend like you never forgot it in the first place, right? It'll be fine.
I totally didn't. That's crazy.
And then the last thing we're going to do is explore perspectives. We'll talk about perspectives of others. Obviously, we all have our own perspective, depending on the situations we've been through in life, how we're doing currently. There's going to be all kinds of different things that that take effect in that. Okay, so when we talk about being a coach, you see these little bubbles on the side. These tell us what we are. We are change agents, collaborators, and we are partners. We focus, if you look on that right side on the bubbles, we focus on a strength-based approach. We talk about our strengths, not our weaknesses. We remind them of their strengths and what maybe worked in the past and what could work today. We talk about present and future goals. We don't necessarily focus on the past if there's something that didn't work out. You know, we don't have to let that hold us back. And then it's whole person centered. We will tell you this over and over and over and over again, and you'll see in all those different examples that we show throughout the class. But there's always going to be that person centered approach. It's always about them. If you learn anything in this class, walk away with knowing that coaching is all about the person you're coaching. It has nothing to do with you as the coach. So we are here to inspire, motivate, and empower. That's our biggest 3 things we're looking for. All right, so here's some differentiatory things between what a coach is, what they're not, and depending on kind of your background, you may have some insight into therapists and mentors, consultants, and then we're going to tell you a little bit about what coaching is. So a therapist deals mostly with a person's past, their trauma, and helps them to seek healing. That is not a coach. We're not there to therapize. I know that's not a word, but somebody used it yesterday and it's like my new favorite. Mentoring deals mostly with succession training and seeks to help someone do what they do. So you're going to notice that we will mentor you throughout the course, but what you're not doing with your client is mentoring them. You're coaching them. There's a difference. Consulting deals mostly with problems and seeks to provide information, expertise, strategy, structure, that kind of stuff. You're not their consultant. You're not there to fix it. So as a coach, you're dealing mostly with the person's present and seeks to guide him or her into more desirable future altogether. And they tell you the specifics of that future. They tell you the specifics of that goal. So I'm not going to sit here and read through all of these and challenge your reading abilities. I'm sure you see some of those differences. Does any of this stand out to you? Does anything on this page stand out to you that you have a question about or that you have a comment about? Therapize.
I think the hardest thing, like for me personally, would be to not tell them, like, well, just go do this, right? Just, why don't you just do this, right? Instead of slowing it back and, you know, letting them come to that determination.
Yeah, it's a hard skill. It's something we have to learn and practice. It's hard not to tell people what to do. Todd struggles. He tries to tell people what to do all the time. He was a drill sergeant. He knows how to tell people what to do and expects it to be done. That as a coach, he can't do that, right? As a coach, I can't tell you, well, get off the couch, stop eating potato chips, and go work out twice, you know, this week or 3 times this week. Get started. Stop making excuses. That's not a good approach. They probably won't come back. Mark, I saw you unmute. What you got?
Yeah, I was just gonna say I like where it says co-creative equal partnership, and which makes the coach helps the client discover their own answers. I don't know. I just thought that was really cool.
Yeah, absolutely. The co-creative part, it actually does get fun as a coach. Just because you're a coach doesn't, well, I don't want to confuse you guys too much, but just because you're a coach doesn't mean you can't help them to get creative. You can. There's different approaches to it, different ways of keeping them in control of the conversation while you're doing it. But we do have the ability to be creative with them and have fun with them. Anything else stand out on there?
I guess under the therapy category, where it says assumes emotions are a symptom of something wrong, that stood out to me, I guess, just because in my experience, I haven't really experienced that. Coming from like a therapy perspective or someone who's been in therapy, in my experience, I've definitely had more of like what is in the coaching category, and that's kind of what like my training was in. So that part seems like it feels natural to me, I guess, but I don't know as much if I like fully, I guess, agree with what is just like blanket in there, but I know it's like a lot more complicated. There's a lot of different types of therapy and therapists and stuff like that. But I don't know, it stood out to me because I'm like, that makes the most sense just in a general.
Yeah. No, I
Is
think,
to assume that they're normal.
yeah.
Emotions are normal.
To be honest with you, I agree with you 100%. To assume emotions are a symptom of something wrong for a therapist, if you blanket that comment across the board, that's probably not accurate, right? And I don't have that experience either in therapy. But what I will say, in our culture, in the Western culture, when do we tend to go get help from a therapist or a mental health provider? When is it we decide we need it?
That's a good point. Yeah, when something is quote unquote wrong.
Court ordered.
Court ordered, yeah.
That too. Lots of
We
different
know.
well, something's wrong there too, though. So
Right. But in the Western world, we have this stigma around mental health, and I'm glad you pointed out because it is a stigma. We think that you need mental health providers when something is wrong, when you need to fix something, right? Instead of, like we think with coaches right now, and we should be thinking about mental health providers like this as well, to assume that all the emotions are natural, all the different stages in life are natural, and it's okay to even prepare for things when it becomes hard, right?
yeah, I guess in my opinion, and just with my own experiences in life, it's I hate the stigma that's around any of it, just because I don't know, worst case scenario, who doesn't love complaining for an hour long?
Right.
You know, just get it out of you. So, something might not always have to be wrong, but like the idea that it's just nice to have someone to talk to, like that's a third party perspective, I guess. So, I don't know, that just stood out to me on the therapy side, but that makes a lot of sense to like we do go when something is wrong. So,
Yeah.
And I'll add, a therapist has to have a diagnosis, right? So they have to assume that those emotions are causing that turmoil, because that's the part that is related to the billable thing that they have to come up with, right? To go see a therapist, you have to have a diagnosis in that first visit to be able to be billed through insurance, right? How well do you know somebody? And you have to do that through an algorithmic way that is laid out already ahead of time. And then you can only see that patient unless they're paying on their own. You can only see them X amount of time that is laid out by their insurance company and what is allowed. So, I guess really, whenever you think about mental health in this aspect too, when we start talking about assuming emotions and therapy types of things, is we're also talking about this in a managed care organization. We're not talking about people paying for this outside of their own and being able to do that. But really, if you go see a therapist, for the most part, you should be seeing a therapist and they should be working with you in evidence-based protocols that, move you along in your trauma treatment, whatever you're getting, depression, and then that therapy should end at some point. They get you back to that neutral place, kind of going back to that illness wellness continuum. Whereas health coaches, again, take that a step further, and they don't use that judgment. They don't use, from the very beginning, they don't use any of that piece as a judgment to be able to get a diagnosis, because their CPT codes don't need a diagnosis to be able to move forward either, right? So then there's that piece that is kind of different from the traditional model of therapy with the coaching model that is coming out as well. So I just kind of wanted to add that piece in there.
Always comes back to the money. That's how you know you truly understand healthcare. All right. Good insight. Okay, so we'll talk more about this as well. Again, just kind of a teaser to show you a little bit, but the coaching process has a model that we separate into 4 stages, okay? Stage 1, we're talking about that map, the mission, aspiration, and purpose, and we're exploring that with the client. This helps us in stage 1 to create that vision of whatever the goal is for them. What is it that they're visioning? We get to explore the values in their life, but we also get to explore value conflicts. And just to make that a very simple and easy kind of understandable thing is, you could say something as simple as, and I say this because it's one we used a lot at the VA, I really want to lose weight, but I also really love donuts. Well, heck, that's a value. I really want to be healthy and lose weight, but my conflict is donuts, right? So you'll have a better skill set on how to explore those. Then, once you kind of have that foundation laid, we jump into stage 2, and this is where we reflect, assess, and we focus in on an area they want to look at. So this is where they talk about a PHI, the personal health inventory, on that video. It can be a whole health inventory. You can call it a lot of different things, but it's basically some questions that gives us an idea, some open-ended questions or some scaling questions that gives us an idea of where they are and where they want to go, where they are right now, meeting our client where they are, and then understanding what their goals are and why their goals are there, the why behind it. We define the focus, assess the readiness to see if they're ready to start making those changes. And we have different skill sets on how to jump into that as well. Okay, then we go into stage 3, and this is where we plan for the action. This is where we've got it all figured out. We understand what they want to see. And now we start creating those goals and those action steps. That's where that SMART comes into play, Kirby, and we'll get into it, but that's where those SMART goals come in. We're going to explore some barriers. So, hey, I want to start running, but I don't own running shoes. That's a barrier, right? But we don't know that until we have that conversation with somebody. We talk about training and support and accountability. This is where we ask them, who's going to hold you accountable? How are you going to know you're successful? Who do you have to help support you? That kind of stuff. And then in stage 4, we're going to execute the action. This is where we then take it one step further. We start to plan, replan if we need to. If we see barriers got in the way and we need to refocus on something, this is where we can do it. We check in on the status of where they are in those action steps or those goals. We learn lessons. If things didn't go quite right, we talk about it. What happened? What are things we need to change? What are things we need to think about? And then we can either replan and take more actions around it, or if they're being successful in what they're doing, you can move forward in that. Okay. Again, lots of skills, lots of different things we're going to use in all those stages. But right now it is just simply to give you an idea of coaching. Okay, so the board has different competencies that this course, as well as any other course that's accredited, has to hit on. And these are the competencies that you're going to see throughout the course. So there's a coaching structure, which we went through those stages right then. That's kind of how we start structuring things. We have a coaching preparation prior to the session. We'll talk about different paperwork that you'll want to have. We'll talk about different things you want to think through before you start coaching. Lots of different avenues, and we'll explore all of those. We'll talk about the first session, the initial sessions, the ongoing sessions, the final session. We'll talk about all of that stuff. We'll talk about the coaching process and mindset. So the coaching relationship, it's a lot like anything that you've probably done in your career. There are lines of being ethical, right? And what is a coaching relationship and what should it not be? Where is that line drawn? Communication, how best to communicate with people, as well as utilizing the techniques and skills that we'll talk about. Health and wellness, basically we're talking about those biometrics that we hit on earlier, about the CDC stuff. There are things you want to know about chronic diseases. There are things you want to know about red flags that you may want to watch for, and that kind of stuff. We'll talk about that. And then we'll talk about the ethical and legal parts of coaching. Holy poop, there are some legal things you need to know. Because with anything, there is always, I don't know why I keep referring to poop today, but there is always professional conduct that you gotta maintain no matter what. All right, any questions about the competencies and what you're gonna learn? Cool. This is the easiest day because I'm not actually teaching you this stuff. I'm teaching you what we're gonna teach you, so I don't really have to know much. That's pretty easy. All right. So there's your model, the process model. We just went over that. I think I just went backwards. All right. Any questions, comments, concerns about what this course will cover? So with all that said, what's a health and wellness coach? Go.
Somebody that helps a person establish their values and set a goal and help hold them accountable to the goal.
Love it. What is a coach? Not. That's totally not grammatically correct, but
A therapist.
Yep.
a therapist. Yeah.
Not a
Doctor?
prescriber, a diagnoser.
Yeah.
Not a doctor, not a prescriber, diagnoser. Absolutely. So moving forward, does everybody feel comfortable with the roles of what a coach will consist of? You feel good about it?
Yeah.
Awesome. All right. So I'm going to turn it over to, I believe, Todd now. I guess I have to quit. Did I quit sharing? Yeah, I did.
Oh, me. And Haley just said she's gets to take it easy because she's just going to tell you what they're going to teach you. Well, I actually see how they dump on me. I actually get the first module that I get to teach you. I'm going to introduce you to one of the first theories that we're going to talk about throughout this. And technology's not my friend, but I think I just did it. We're going to go ahead. Oh, let me go ahead and grab this from over here. Put it where I can see it. What we're going to do is we're going to talk about the trans-theoretical model of change. It's been around for less time than I've been around. So it's been around since '83. Pacheco and DeClempty developed it way back then, but it's an integrative biopsychosocial model to conceptualize the process of intentional behavioral change. And that just tells you what they did. They did a little test, interviewed 1,500 people, weight loss, smoking cessation, that people make sustainable changes on their own timeline and according to their values and their social support. People do what they want to do, not what we tell them to do. And it's really synergistic, and that modifying behavior alone is not effective long term. And if you look at that, the big thing, you know, that draws my mind is, you know, anybody watch an hour of TV, you're going to see a commercial for a weight loss program. These weight loss programs, they put you in, they have great success. People lose a lot of weight over a limited amount of time, 98% success rate. But then 6 months to 90 days after they get out of the program, they're right back to where they were, or even put on a few extra pounds. They modified the behavior in that limited time frame, and it wasn't sustainable, and it wasn't effective long term. And here we're going to talk about those stages of change, and there's 6 of them. And you got the pre-contemplation, contemplation, preparation, action, maintenance, recycle, and relapse. And I'm going to just say that, you know, you got to understand that we talked a lot about life and everything as we've been talking. People can be in different stages of change in different aspects of their life. They may be ready, you know, to make a change in one area, but they're totally in pre-contemplation in another area. And the other thing that I'm going to say before we get into these definitions is, this is really for you as health coaches. I want you to look at this theory as a theory that allows you to meet the client where they're at. It's to inform you, your understanding, you know, because when you look at the definition of pre-contemplation, someone that doesn't intend to make a change in 6 months, a lot of people may, oh, that person's not ready for coaching. Come back when you're in contemplation or you're in preparation. But really, it's for us to meet them where they're at and understand that maybe we got to do a little more exploration with them, that in pre-contemplation, a little more vision and values exploration to help them find their why. But pre-contemplation, can I get someone to read that real quick?
Yeah, a person in pre-contemplation is not ready to change and does not intend to change in the next 6 months.
And again, you know, that person, you know, still ready to be coached. It's just, we got to spend that time creating that vision, painting that pictures. You don't know what's going to be the impetus to change. And, you know, I think somebody earlier and there's talked about change being emotion driven, and a lot of times it is, but we got to really explore that with somebody. And then we have contemplation. A person in contemplation, you know, they got a little ambivalence going on. They can see, yeah, you know, I should quit smoking, and I also, you know, it helps me alleviate stress. It gives me 6 extra breaks at work that my coworkers don't get. You know, they got a little ambivalence. They can see reasons on both sides of the coin. But it's really that first stage when someone's in contemplation, when they're really starting to be able to see the possibility and some reasoning for change. Someone want to read preparation for me?
A person in preparation has made the decision to implement change and is beginning to prepare for change within the next month.
Yeah, that's that person. Maybe they're doing some research. Maybe their mind's made up. They're starting to look at gyms that are underway on their route to work, or, you know, they're thinking about, you know, maybe changing their grocery list or changing their buying habits at the grocery store. You know, that's that preparation stage. That's where we're at. Then we got action. That person in the action stage, you know, they've started doing something within the past month, and they're working on really developing a plan and to sustain the change. They put things, it's right there, and they've implemented. They're moving towards, they're working at, they're taking those steps. You know, look at it as someone that started down that journey. They planned their trip and they've taken that first step down that path, down that journey. And then somebody that's in that maintenance, that person, you know, they've been doing it, the behavior change, it's been ongoing. They've been been able to maintain it for 6 months or better, and they're doing pretty well with it. Someone want to read that one for me?
Sure. Once a behavior has been maintained for more than 6 months, the coach helps the person determine between termination and continued maintenance.
Yeah, and that's really where they're at. You know, we can move into another area. They can start working in another area. And the other thing that we got to understand too, you know, is this is a cyclic process, and people can relapse. They can fall back into the old behaviors, and you know, because, and I like saying it like this, you know, back in the early 90s, Mike Tyson says everybody has a plan till they get punched in the face. Well, as coaches, we help people develop plans, and life will punch them in the face. So there can be relapses and some things that where maybe we got to go back into the preparation stage. We got to get back at it. We got to go back into the action stage with them. But that's really where we're at with these stages of change. You got the pre-contemplation, contemplation, preparation, action, maintenance, and then you got this relapse or recycle. And also understanding that people can be in different stages in different areas. So as you guys are just started your path, evidently you're already in the action stage of your steps towards becoming health and wellness coach. Why do you think it's important to understand these stages of change as health and wellness coaches?
You're going to get a better understanding of where that individual is at and how to help support them.
Meet them where they're at. You know, we can meet them where they're at with that beginner's mind, with acceptance, honoring their autonomy, encourage growth and learning. And I think someone said it, that non-judgmental approach that we have. And, you know, when I think of beginner's mind, again, you know, you guys will get to know me, but I try to make things simple. I just call it toddler brain. That 2-3-year-old, everything's new and exciting to them. You know, just meeting someone where they're at, you know, with that acceptance piece and honoring who they are. Then it also allows us, these stages of change, we can explore for some more deeper understanding. Look at their interests. What motivates them? What's their readiness to explore? Really, what's important to them? You know, look at what they want their health for. And just our understanding of these changes has changed. It really helps us to meet them where they're at and then set up that path of exploration with them.